I don't have much dry eyes anymore. I don't have any floaters anymore.
Okay, the floaters are gone. So
Yes, no
what I'm
floaters.
hearing is you're reversing the uveitis.
Yes.
Hi, everyone. I'm Anna Manuel. I'm the co-host of Transform Table Talk Live alongside Dr. Maggie Yu. Today, we have an alumni interview for you with Rashmi. Rashmi just graduated the program less than 2 weeks ago, and she was dealing with many issues. Going back 10 plus years, she started accumulating problems. She had a very, very large fibroid that was causing her a lot of pain and very heavy menstrual bleeding. She was dealing with hair loss and low libido, a lot of hormonal issues that the doctors were just saying to her, well, you're at that age, just live with it. And she didn't really love that, but what was she going to do? Next comes her chronic constipation. She was dealing with a lot of digestive issues after getting her gallbladder removed. She also had extreme fatigue and sinus issues. Her sinus issues had gotten so bad, she lost her sense of smell and her sense of taste had been altered as well. But it wasn't until she developed something called uveitis, or inflammation in her eyes, that she knew she really needed to find somebody to help, because she struggled for 3 years with just this cycle of using steroid eye drops, and then she got cataracts, and they said, we can't help you with the cataracts until you get the inflammation under control. So who did she turn to get that inflammation under control but Dr. Maggie Yu and the Transform program? I can't wait for you to hear how much different her life is today. Hi, Rashmi. Why don't you introduce yourself?
Hi, this is Rashmi Uppal. I live in Folsom, California. I live with my husband and 2 boys and a dog who is 17 years old and 14 years old, and the dog is 3 years old.
Full
I'm
house.
a software engineer.
A software engineer. And I know you have a high-powered job. You actually are the IT director for an entire state. Is that right?
Yes, for one department.
So it sounds like that's a busy job and something that keeps you on your toes, certainly. And I know that some of your health problems probably made your job challenging, to say the least. The problems, when you really look back, started accumulating about 2015 or so. Is that right?
That is correct. Maybe a little bit older there too. But I guess when I started realizing it, yes, it is 2015 where I started having is like, okay, oh, I have to live with this fibroid issue. I have to live with sinusitis. And then, of course, all the hormonal issue, hair loss, severe hair loss, and having all those anxiety issues, hormone imbalances, but never had any answers from anyone. My gallbladder was removed in 2021, but yes, it's too many years of pain. And finally, I really got frustrated in 2021 when I was diagnosed with uveitis.
Okay, well, let's stop there for a moment, because I really want to explore exactly what was going on with the multitude of health problems. So you mentioned fibroid. Tell me about the symptoms you were experiencing with fibroids. Yours was quite big, correct?
Yes. It was like a close to tennis size ball.
Okay, and so this is causing you, I imagine, pain and probably heavy menstrual bleeding.
That is correct. Very heavy, like severe heavy, because it actually brought down my ferritin to 3 or 6.
3 or 6 was your level for ferritin?
Yes. Still, there was
now
no
that level, it needs to be much, much higher than that. So you had an extreme amount of blood loss every single month.
And 7 days of cycle. It's not just 4 or 5. It was very hard. And my hemoglobin was around 7 those days.
And I'm wondering, as a working mom and wife, how were you able to continue to go about your day?
It was hard. Oh my gosh. I still remember I was in a board meeting and I had 2 pads and a tampon on. It just, when I got up, my chair was full of blood.
What was that like for you in a professional environment too?
It was embarrassing, very embarrassing, very, I would say, I don't know, maybe it was my age. It's not that, it was actually draining me down more mentally than physically, but it was totally draining me out. And a fear, oh my God, what can happen so those 5 or 6 days, I just avoid going anywhere, work from home. It was challenging. It's very hard.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of transform. Go ahead, click the link, and I'll see you in that training.
On a scale of 1 to 10, where would
Yeah.
you rate pain?
Oh, a 9.
A 9. Okay.
Yeah. Oh, I used to live in on like every 4 hours. I used to alternate ibuprofen and Tylenol.
Oh gosh.
Yes, that's how I lived.
Okay. So what kind of help did you get from your doctor? I imagine you went to see what, your gynecologist?
Nothing. They told me, they suggested me make a call if you don't want any more kids, because I was around 36 of my age. If you don't want any kid, go for hysterectomy.
The only option was let's remove your organs.
Yes, that's what they told me. And because my ferritin was going so low, one of the physician, PCP, she was a good friend of mine. She said, at least go for the diffusion. So I did have iron diffusions, but that didn't really help a lot. So
Wasn't making a dent in the problem here.
exactly. So I just lived with it. There was no solution other than hysterectomy.
Okay.
Then I think I myself researched and came up with this microablation instead of hysterectomy.
To try to remove a portion of, to try to remove the fibroid itself?
Exactly. And
Okay.
I think I went through that through a laser. I requested my PCP and then, gynec. And he said, oh, yeah, you can do that. And it may stay for longer. But I think I still got it after 3 years. It just popped up.
So you
But-
got it removed and then it came back, you're saying, after 3 years?
Yes. Yeah.
Oh, gosh. Okay. So this was not a long-term solution. And
No. And
was
I
it-
have multiple now. So it's not just one. I have smaller sizes, multiple, and then one big size.
All right.
Mhm.
At the same time, you knew your hormones were imbalanced and you said you were experiencing hair loss as well. Tell me about
So, this is so funny. Whenever I go to my PCP, he just says, "Oh, after 40, this is what happens with women." I said, "Oh, I have really low libido," and he says, "Yeah, this is the age," and it's like after 40, and then I think they just try to convince me it's okay to live like that, as if my life is ended.
right. To be told, oh, you're just at that age. And I cannot tell you, Rashmi, how many women are just brushed off in that way. You know now, after going through the Transform program, that any of these hormonal symptoms, we don't have to live with them. There
No.
is an answer. And so it had to be frustrating, I imagine.
Oh my God, it is frustrating. And I would say more than frustrating, it's brutal. It's like, no, I don't want to live like that. My nails were brittle. And then I myself researching, going for whatever I can do. But there is no medical solution or an answer from any one of them. I mean, I'm not saying, I'm not blaming them. Probably the system is built like that.
Yeah.
They just don't know what the root cause and how I can fix it.
How
Easily.
bad was the problem? Was the hair coming out like in clumps in the shower?
Yes. Like every time I comb, I get clumps of hair, and then shower is like unbelievable.
What did that feel like for you as a woman to be losing your hair?
I think you actually nailed it very well. It's your identity. And then also, as I told you, I have such a high profile job, and many times I'm a speaker for the technology for my group. I have to dress up, I have to be presentable, and then every time I look at me and I'm like, oh my God, I'm going bald. It is very demoralizing. I was losing confidence because of I don't know if a spectator of the public care about it, but you yourself do care. What's going on? I can't do this hairstyle. I don't want to do this all the time of, volumizing the hair. No, I want my own hair. It's like,
I understand that. You nailed it when you said no. It was taking a hit on my confidence, and that can affect so many different aspects of your life.
Yes.
Now, I heard you also mention sinusitis. So what was going on with your sinuses? Is this simultaneously happening?
Oh, yes. Since I live in a Sacramento Valley, so it started with every time I'm waking up in the morning, I'm stuffy nose. Every time I wake up. So it started during the allergy season. So doctor just told me, oh, it's quite allergies. Maybe you're developing some environmental allergies. And I've been using all those Claritin, Allegra, the sinus rinse. I mean, name it, I have used it, and
Right.
nothing is impacting. Every time I make calls to my friends, my family, this is, what's going on with your nose and with your voice? And do you have cough? Do you have cold? I said, no. It's just all the time stuffy. Over the years, it went so bad that it also started impacting me, my sense of smell.
Okay, so your sinusitis was now starting to get worse. Not only were you stuffy, not only did you feel congested, did you have facial pain as well?
Yes, little ache here all over my face. Yes.
Okay, so some mild, always ever present aching, but now you have lost your sense of smell, which probably also impacted your sense of taste, perhaps?
Yes, which I never understood. But yes, a sense of smell. This started happening around 2020. Every time I say my sinus, I'm losing the sense of smell. They run this test on me 15 days, a month. Every time I never tested positive, never ever.
Let's just call it the big C or the virus. So you were never testing positive for the virus, but
No.
you were experiencing symptoms similar to how some people experience. But so you think that that was just all from chronic sinusitis then?
Yes. And I think my doctor actually declared, and then he said, oh, we need your sinus surgery. So
Okay. So now we have a second surgery being offered.
Yes.
So that was happening. Then you also mentioned your digestion was not doing well and you had your gallbladder removed during this similar time period. What
Yes.
led to the gallbladder being removed?
So one night I had to call ER. I just have this cannot breathe, and I had a very severe pain on my just below the chest and the in between the chest and the tummy somewhere, and then also the lower abdominal. I couldn't figure it out what's happening. We called ER. I went in. They ran through a lot of tests, and they came up it's something related to gallbladder. I think they gave me some meds, and it relieved me immediately, and I was okay. Then also they told me they can't do anything until I have a similar episode again.
Oh, okay.
If it happens 2 times or 3 times, then probably we'll go with bladder removal surgery. And it happened again in 6 months. And I think finally they said I had a lot of sand, not the stone, but full of sand in my bladder. That's
Sludge, some
Yes.
sludge, probably sludge.
Mhm.
But I'm curious to hear what happened to your digestion after they took your gallbladder out.
They never discussed ever about digestion, ever. I just started having feeling that I'm not digesting my food. And I started this intermittent fasting, starting from 12 to 14 to 18 hours of fasting.
Ah. Why did you start that? Because you didn't feel well after eating, so you just
Yes.
okay. Intermittent fasting, I will eat less, so hopefully I'll feel this pain less.
Exactly. And I may lose weight too. And then eventually, this is just my body telling me I stopped eating meat because I thought it is giving me a problem with meat. But whenever I go back to doctor, they never told me that you need an additional thing to digest meat.
And
No.
so what happened?
I had developed constipation.
Yeah. How bad was it?
If I don't take any supplement, until I take that, it can go for 2 days, a few days, nothing happens. And again, it could be because I was just eating 1 meal a day, but still, I don't want to eat anything until I just get off that whatever I ate. So it's like, it was getting worse. It was ridiculous. Everyone around my family member was saying, you eat like a bird. I just stopped eating. And it's not that I stopped eating and I'm losing tons of weight. Nothing like that. It's just, I just don't like eating.
So I imagine you were dealing with some bloating as well.
Yes, a lot of bloating, lots of indigestion, and sometimes it's just acidic burps. And I said, why am I getting acidity? I'd never had in my life.
Unfortunately, what you experienced, very common. So you mentioned all of these problems continued to accumulate, but you were just getting through it and surviving, even though there really weren't great answers, until it sounds like the next big health issue came. And what was that?
Yes. So in 2021, around September, I got diagnosed with this uveitis.
Okay. And for people who don't understand what uveitis is, this is an inflammation of your eyes, and it can cause a lot of issues with eyesight.
Yes. I was getting floaters. And
was it painful as well?
Luckily not. Mine was not hurtful, touch wood, but I did have a lot of dry eyes.
Dry eyes and floaters.
Yes.
So it was impacting your vision in a meaningful way?
It is, yes.
Okay. All right. So you go to the eye doctor. Did they give you any kind of idea why this was happening?
No, they ran tons of tests and everything came negative.
Mhm.
And then I think they did even do that autoimmunity test. That also did not come positive. But they did say this is a chronic uveitis. It's some sort of autoimmune disease.
Yeah. It's very often caused by an autoimmune disease.
Of course, as every autoimmune disease, the treatment or the solution is steroids. It started from 5 times a day to 4, 3, 2, a series. I think I finished that whole dosage period and then stays maybe for a month or so, then again starts the same cycle. Oh my gosh, it's a tropical steroid. Of course, the side effect of those is either you develop glaucoma or cataract.
And what did you develop?
And mine is cataract.
Okay. So I'm curious, how long did this process go on for with you in trying to treat the eyes in this way?
3+ years.
Okay. And what was the turning point for you, Rashmi, where you finally said, enough is enough? I have to figure out why this is happening and maybe try to put a stop to this.
So one day, due to my inflammation, of course, the cataract developed. I went for the checkup and my doctor told me, yeah, a cataract is not a big surgery. Everyone knows about it. But then in my case situation, it's different. It's because due to the steroid-induced cataract.
Mhm.
So they said you have to make sure your eyes are calm, not inflamed for
Decrease.
longer time.
Okay. And you're like, how am I going to do that?
Exactly. And then only they can do the surgery on my cataract. And it is impacting my day-to-day life, my work. And I was just sitting so disheartened. What can I do? What do I do to maintain this calmness in my eyes? Because they will not do the surgery. And I guess I was just browsing in details of what it is, what autoimmune is, and where I think I saw Dr. Maggie's YouTube video. Luckily, I don't know, it was a God sent video because the video I saw was my dry eyes is gone, uveitis is gone. I said, oh my gosh, who is this?
Somebody knows how to get to the root of this and fix it.
Exactly. And same terminology, same stuff going on with the whoever is doing the testimonial. It was some patient. And I just started digging in. Still, in my mind, and after listening to so many doctors, conventional medicine doctors, and it's like too true to come true, right? It's like you can't believe, and is this a scam? First thing came in my mind.
So let me just understand. You saw somebody who had graduated from Dr. Maggie's program talking about how her or his uveitis had improved, gotten better. They weren't dealing with it anymore. And you said, how is that possible? This
exactly.
Perhaps this is a scam.
Yes.
Okay, so what was the next step you took?
I figured it out where it is coming and who is actually, because she did mention about Dr. Maggie. So I did send a message on Instagram, I guess, and I got respond immediately after a few hours. And then I actually had a consulting call, maybe 2 or 3 consulting call to understand what exactly are they talking about. Is it curable? Is it reversible? I couldn't even believe when I was talking. And, as I said, I was so disheartened. And I thought maybe this is a sign. It's a direction somebody is guiding me to. And I signed up.
You signed up.
Fingers crossed, and I signed it up. It was amazing. I would say I still believe that I did the right thing. Thank God I did it.
Okay, because let's talk about the results. When did you graduate the program?
I graduated around 4th of February.
So you're just out of the program at the time of us doing this interview. That's only about like a week and a half ago.
Yes, that is.
Okay. So you're out of the program. I want to go symptom by symptom here from some of your ailments and hear how they have changed. Where do we stand with the fibroids and the bleeding right now?
Yeah, so I believe since I'm 48 years old, so I guess I did hit that. I won't call menopause because it's not been a year since I don't have periods, but yeah, it's been 4 months. Yeah, it's a premenopause. So there's no bleeding anymore.
Okay, so no more bleeding. That's an improvement. What about so that you're not experiencing any pain then as well?
No, actually, no pain. My anxiety has reduced a lot.
Okay.
And the fatigue. I don't feel fatigue anymore. Oh my gosh. I used to the moment I used to eat food, I want to lie down. And I used to feel so bad. It's like people say you get energy out of food. And I was like, oh my gosh. But since I started this program, just after a week or two, my fatigue is gone. It's
It's
all gone.
all of it.
That disappeared. My hair loss, oh my gosh. I won't say I got all hair back, but hair loss has reduced. It's
Okay.
not falling, so hopefully I will get it back now. So
Yes. Okay. The hair loss has stopped. That is such
Mhm.
a huge thing to celebrate.
Oh my gosh. I used to wash my hair like 3 times a week. Because of the shedding, I reduced it to 2 times a week. But now I don't have any fear of washing my hair. It's not losing that way. So it's like, oh my gosh. I used to not comb my hair in a day because I know it will just come in a clumsy way.
Trauma of having to wash your hair or combing your hair has gone away.
Yes,
That's
it
a
is.
for in of itself.
And my nails, because my nail lady told me, wow, your nail looks stronger. I said, oh, thank you. Like I've been going to her for past 15 years. And she said, your nails are stronger. I said, oh, thank you.
That's wonderful to hear. I want to hear about your sinus issues. Is your sense of smell back?
Yes, fully back. Fully
Fully
back. Oh my gosh. It's like I was telling, my family members were so used to of me not smelling. Anything comes up and they say, Mom, there is some even nice or bad smell. And they say, oh, you may not be smelling. I said, no, I can smell too. I feel it now. I said, wow.
Okay. So the sinus pressure, the stuffiness, has that dissipated?
Yes, I don't feel any pressure anymore. I am not using any sinus rinses, no Allegra, no Claritin, and I feel good.
And that's since you graduated the program or since you started the program?
Actually, just after 2 weeks, I started the program.
So within 2 weeks of
Yes.
joining the program, your sinus issues, which had been going on for a decade plus.
Yeah, it just went off.
That's truly incredible, Rashmi.
It is. I feel like I never had anything. Every morning I'm waking up, I keep facial tissue right next to me that I'm going to use them, and it's been a while. I've not used any of them.
The box is still full.
Yes.
Love it. Okay, that's wonderful. Next, I want to hear about your digestion. How are we doing with the constipation?
I started using Digest It, and yes, it's really amazing.
So no more constipation.
No more constipation. And I was also told to take Ox Bile by Dr. Maggie because there's no gallbladder.
Yes.
And I think that is helping a lot too.
Okay. Now you're able to go to the bathroom normally. You're eliminating.
Not maybe 2-3 times a day, not just once. So it's amazing.
Nothing that feels better sometimes than being able to have a great bowel movement.
Yes, it is. I think I feel every meal I eat, yes, I digest it. I feel that way in my body. So
And have you been able to bring foods back into your diet as a result of this?
I did. So because of, as I mentioned, right, because I feel very uneasy whenever I was eating any kind of fat, whether it's a meat or direct fat. So I did introduce back fish and chicken to my diet, and I feel good.
And you feel good.
Yes.
You're not feeling bloated.
And I think even the food mapping is a blessing because
Talk about that. What did you learn in food mapping?
I'm sensitive to cow milk and all the cheese. Now I know why I used to feel bloating just having a bite of cheese or something. And I said, I didn't eat anything, still I'm bad. So yes, that was a discovery.
Okay, speaking of inflammation, here's the big one. I want to hear, how are your eyes? Where do we stand with the uveitis?
My inflammation is stable, and I'm going for a surgery on 21st of February this
when
month.
You say inflammation is stable, you have decreased the inflammation to a point where you're now able to have the cataract surgery?
Yes, that is right.
Rashmi, when it comes to vision, this is not something that you can mess around with. So to be able to then go and get to a place where you're able to go correct the issue of the cataracts, what's that for you?
You won't believe it. That was a breaking point in my life. Means I know how many times I have cried, but yes, this is something, I think this is the best thing to happen in the life. And dry eyes, I don't have much dry eyes anymore. I don't have any floaters anymore.
Okay, the floaters are gone. So
yes,
what I'm hearing is you're reversing the uveitis.
Yes, hopefully. And I'm waiting after my cataract. If I maintain this, I'll be out of any dosage of the steroids.
Amazing. Okay, so now people are going to want to know, What made the difference? This isn't just Dr. Maggie having a magic wand. What did you do that you think made the difference for you?
Definitely, I would say it has, Dr. Maggie does have a magic wand. It does play a big role. But I think other than that, the whole program, why I like the program and why it has been so successful, I believe so, is it's not just something you go and take this medicine and you will have something like that. No. Every member in Dr. Maggie's team, they actually teach you, walk you through why and how. And they don't want you to be dependent on them forever. You learn your body, you are the master of your body, and you know the solutions, and they teach you that. I think that makes this program very different and successful for myself too.
A whole body approach. There was everything that you did throughout the program contributed. So you removed through food mapping trigger foods. You balanced your blood sugar to a much, much better level than before. You're hydrating your body properly, knowing the amount of water you need to be taking in every day. And I imagine you had some eye-opening information when Dr. Maggie went through your hormones.
Yes, I did. Luckily, my thyroids were all good, but my hormones were like zip zap, up and down, up and down. There was, I think, not a single thing was right. Based on my hormone test, I've been diagnosed with the PCOS and the low estrogen.
Okay.
So actually, not low estrogen, but dominant. So
okay,
with the low,
PCOS
but
with estrogen dominance,
yes.
Even though your levels were also low, were all of your hormones low? Had any doctor, through your fibroid issues, all of your hair loss struggles, it's starting to add up. Had anyone ever mentioned, oh, Rashmi, I think you might have polycystic ovary syndrome?
No, never, ever.
Never.
And of course, I had all my cortisol level is always high. That's the reason I could not sleep.
It almost sounds miraculous how your life has turned around. You can put the uveitis behind you because it sounds like you're well on your way. The constipation's already gone. All of your other problems have cleared up. Your sinusitis is gone. Uveitis is going away, which is incredible. Now you're that success story, much like the person who it all started with, and you watched their success story. Well, now it's your turn. You're that success story. And it's interesting because you know what, of the people who go through the program, you're not unique. I'm curious to hear what kinds of things you saw from the community of those going through it with you. Was everybody having wins and successes?
Yes, I would say 95+% I have seen successful. The kind of disease it is, like autoimmune, the way it impacts you and your body, even seeing out the world and see that, oh, you are not alone in this journey, I think gives you a lot of benefit of, I would say, motivation or, concealment. Okay, I'm not alone in this journey. And seeing their results that, yes, it is reversible. People talk about it, how they overcome these. It's a great motivated forum, I believe. So open, people speak. Even if they don't feel anything, there is no result out of for 2 days or 6 days, they speak up and they again change something and then they see the results. So it's so open. I love the open door policy. Yeah,
you have that community. So you really have had a dramatic, life-changing turnaround. What would you say to somebody out there who is thinking about joining the Transform program? Who is this program for?
Anyone with any kind of autoimmune disease, I would highly recommend. Please join the program. Doesn't matter, even if you have not heard that condition, which is called as autoimmune and not heard by anyone, but just join this program. And apart from that, I believe, and again, being a woman, I know what it takes. Every woman who have all these undiagnosed underlying condition, such as a brain fog, digestion issue, low libido, hair loss, and think it is okay to live with it, I would highly recommend them to join this program. Don't blame it to the age. Join the program. It is reversible. You can reverse those conditions.
There are solutions out there. You don't have to live like this.
Yes.
I want to hear some things from you now that you're able to do that you couldn't dream of doing before the program.
I think my fear of eating is gone. I can eat where I want to and what I feel like eating. And again, majorly is on my eyes. It's been 12 weeks. I have a consistent no inflammation and no dry eyes. It's a big win. Yes. And of course, the hair loss, nails. So I would say this all, and it is again, it's not, my journey is not over. I would say it just started. I have to keep maintaining it. It is my way of life to live with this and live healthy.
Well, congratulations. I am so happy for you. Your life has improved dramatically. And
Yeah.
it's all because you did the research, you took a chance, you joined the program, and then you did the work. And now you're
Yeah.
reaping the rewards.
Yes, I would say definitely that the education within the program, the way
Yeah.
it has been built, I would say it's really very good. It covers, you just think of anything and there is an answer for it. I have so many doctors in my, as a friend, and when I talk to them, it sounds like, wow, where are you studying all this? And I said, yeah, I'm learning it.
Because you feel like you're a doctor able to talk to them on that same level now, is what I'm hearing from you.
Exactly. The terminology and make them understand is like, no, this is what we understand, and this is exactly what's happening.
There's a lot to catch up on in the conventional medicine world, but luckily there are people out there, Dr. Maggie specifically, because she is really, as I talk and do more of these interviews, she is the one to turn to when it comes to if you want to get to the root cause of what's going on with your body.
That's correct.
And you
Yep.
did. And you did, Rashmi. Congratulations.
Thank you. Thanks, Anne.
I am so happy for Rashmi to hear that pretty much her life did a complete 180. Her sinusitis, totally gone. She can smell again. Her hair loss has stopped. Her fibroid and her heavy period, that issue has resolved itself as well. Her fatigue is gone. And her uveitis, that doctors said, we don't know if this is ever going to get better. You're just going to have to continue to use these steroid eye drops forever, maybe. Well, that is going away. Yes, you can decrease the inflammation and uveitis can go away. It's all about getting to the root cause of what's causing these issues. And that's what Dr. Maggie and the Transform program are all about. If you would like to learn more about Dr. Maggie's 5 pillars to turn around any chronic health condition, there will be a link above or below this video that you can reach out to the Transform team. They will get you hooked up with resources and you can learn more. On behalf of Dr. Maggie Yu and the whole Transform team, I'm Anna Manuel. Thank you for watching.
Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.